Hi, I'm Dr. Kevin Haney. I'm a radiologist. I'm the owner and medical director of Ozark Regional Vein and Artery Center.
And I'm Christopher Stout. I'm a vascular and endovascular surgeon, and today we're going to talk about which doctor is right for you, for your arteries or your veins.
The veins are thin-walled, low pressure, and they're supposed to be bringing the blood back from the arms and legs back to the heart to get recycled. They have a series of little valves in them that keep the pressure really low, so the blood only goes a little ways before there's another valve. And so when the valves fail and you have nothing stopping that pressure, that column of blood, then you end up with a high pressure system or high air pressure system, and that's when it causes problems. Arteries are under high pressure because they're directly out of the heart. Every time the heart contracts, it pushes out with high pressure blood to the feet and to the arms and to the brain. And they're thicker walled and they are under pressure because the heart is contracting.
So with the pressure differential between the veins and the arteries, that can lead to different, problems with those vessels. And the treatment between the two can be similar, but then again, quite a bit different. A lot of times with the arterial side, the arteries are taking blood down, you get a blockage in them and you just can't get blood to whatever needs to get blood, and that can lead to pains and aches and problems. But with the veins, sometimes you get too much blood pooling.
Right. And so if the blood can't make it back to the heart because it keeps shortcutting and running back down to the foot, then that's not going to help you out. You're going to feel achy, heavy, tired, cramps, maybe lead to ulcers, clots, bleeding, all those kinds of problems.
To realize that your leg hurts, whether it be at night or when you walk or cramping, it just kind of depends. It's hard to figure out which doctor to go to. The disease can be mixed. It could be a problem with a nerve, it could be a problem with an artery or a vein. And that's one of the things that we're going to be able to do here is we're going to be able to tease out what's causing this. And a lot of times we can, with simple screening tests and other type of testing that we can do in the office with ultrasound, which is non-invasive, we can say this is most likely your vein, or this is most likely your artery, or it's both. And there's going to be the occasion that it's going to be something to do with a pinched nerve or a back problem, and then we can work to get the patients where they need to be into the appropriate doctor. Dr. Haney will work on the vein side and get those patients all better, and I'll work on the arterial side and get those patients better. And if it's anything else, we can point the patient and get them in the right direction.